Abortion. What is abortion? What is the difference between medical termination of pregnancy and miscarriages? What are the safe methods and the legally correct methods to land up with getting the services for abortion? That is what we are going to discuss in this video. More importantly, remember, the safe abortion is your right and you need to know it, how to get it. Hi, I am Dr. Mukesh Gupta, obstetrician and gynecologist from lenest, Mumbai. The topic today, abortions, especially with a focus on medical termination of pregnancy, that is MTPs. Well, when we talk about abortion, it is expulsion of the products of conception before the age of viability. Now, when it happens with choice, that is when you're planning it because of the reason choice as in for justified legal indications, then it is called as medical termination of pregnancy. But when it happens on its own, it is called as spontaneous abortion. Before we go to the medical termination of pregnancy, let me finish with the issue of spontaneous abortion, which is very commonly termed as miscarriages by everyone. Well, it can be a spontaneous abortion when the pregnancy has not continued on its own and it has aborted on its own. And this can actually lead to a situation where you wanted to have the pregnancy, but it has happened. So how do we go about it? We have a separate video on that, that is miscarriages in pregnancy. You can look for that, or another video on bleeding in early pregnancy, which will help you to know a little more about this condition. If you're not already subscribed to our channel lenest, please do that and press the bell icon for having subsequent videos reaching you very easily and smoothly. Well, when we talk about the spontaneous abortions, it can be a spontaneous complete abortion when everything has happened and completed, or it can be a spontaneous inevitable abortion where an inevitable situation has happened and now the abortion is surely going to happen because pregnancy is not going to continue. It can be an incomplete or a complete abortion if the complete products are expelled or if it is not completely expelled. Well, the treatment protocol for that differs. But when we talk about MTP or medical termination of pregnancy, or in other words, induced abortion, when otherwise a pregnancy is actually not going to happen or not going to abort on its own, but we have to do something about it, that's called as medical termination of pregnancy. In India, way back in 1971, the laws were passed to actually give a guideline for the medical termination of pregnancy in India. Before that, it was illegal to get an MTP done. After that, the government made it a lawful activity. But they laid down some rules. So any woman who wants to have an abortion done, they have to understand that the Act governs three important things. The first thing is who can do it, meaning a registered medical practitioner or a gynecologist who is trained to do it can only do it. An average person or any Tom, Dick and Harry cannot do it. Even a non-licensed doctor or a person who has not got a registered degree with the registered medical council is actually illegal. Okay. Second, where can we do it? Now, the government has laid down criteria about the setups where it can be done. So only those setups which have been licensed to do the MTP can do it. Anywhere else, it is illegal. Also, if you are taking a medical abortion in the form of a tablet at any consulting room by a doctor which is not having license for MTP as such the setup, they need to have a certificate displaying in their consulting room which specifically says that they are associated with so and so hospital which has got license for MTP, and the permission is given by that hospital for allowing them to bring their emergency cases. This was done because in case of crisis or emergencies, what happens is the patient may need an abortion, but because of inavailability of services of attachment of the doctor, it can lead to complication to the patient, and hence unless they have an attachment to a hospital where MTP is legally allowed, they cannot give even the tablets in their consulting room. So where can it do it? Who can do it? Where can it be done? And the third important criteria is who can get an abortion done. So it is very simple. Only if there is a threat to the life of the mother, emotional, physical, or maybe psychological, or if there is an anomaly in the baby which is dangerous to the life of the baby, only then can the abortion be done. So it cannot be done by choice. So doing abortions for deciding whether I want a boy or a girl is absolutely illegal in our country. Okay. Now, when we talk about the abortion methodologies, how do we get the abortion done and what are the options to get it done safely and legally? So, depending on what is the gestational age of your pregnancy, means how long you have been in the journey of pregnancy, the methodologies change. So up to 7 to 9 weeks, it can be done by tablets and medications. Up to 12 weeks, it can be done by a procedure called dilatation and evacuation, suction evacuation, that is called as vacuum aspiration. And after that procedure, after 12 weeks, it can be done by a second trimester methodologies, and which is like a mini labor where you have a contraction and the products of conception is expelled out of the uterus. So let me talk a little more about the first method, that is medical termination of pregnancy by medical management or by tablets. So there are definitive guidelines for giving these tablets. So if you want to plan an abortion or MTP before the 7 to 9 weeks, why am I saying 7 to 9 weeks? Because before 7 weeks, the success rate of these medical treatment is much better. And after 7 up to 9 weeks, it may be permitted up to 9 weeks, but it is a little lesser than 7 weeks. So given a choice, if you really want to plan it, it is better to plan it as early as before 7 weeks. What is the protocol? What are the prerequisites? Well, first and foremost thing is that you need to have a checkup done by a gynecologist or a good registered medical practitioner who is trained to check these kind of situations, and they will decide on your eligibility for it. Meaning they may want to get your general examination done, like your history and other things for knowing the complications. There is a rule that we need to rule out risk of ectopic, and if your hemoglobin is low, we want to take care of your hemoglobin because you may have a bleeding which can cause trouble and it can be life-threatening situation. Sonography may not be mandatory, but it is a good recommendation because if there is a doubt of a patient having an ectopic pregnancy or an adnexal mass or if abnormal uterine shape, then in those cases it makes sense for us to have the sonography and know exactly what is the size of the pregnancy. Especially when the cycles are irregular, it becomes a big challenge. Once we have done these prior investigation and evaluation, then comes the protocol for the medical management. The medicines can be given, the first dose is given on day 1, the second dose is given on day 2, and that is actually the combination of medications, mifepristone, misoprostol, etc., which is as per the standard guidelines as prescribed by your doctor. It cannot be randomly picked up from a chemist. If you do that, it is illegal. Let me tell you that unsafe abortion is a cause for 10 to 13% mortality associated with pregnancy. So almost half of the patients who are wanting abortions, they may land up knowingly or unknowingly to a setup or a center or a doctor where they land up getting exposed to unsafe abortion, and that is a very dangerous situation, which is what we don't want, and hence these kind of awareness programs and videos and awareness activities are very important. Now coming back to the protocol, so once the medications are given, after your second dose you may start having cramps, pain and bleeding. If you don't have any pain or any bleeding or any cramps and any expulsion of products for a few hours after that, please connect with your doctor and inform them that the medicine is not working. You may be given a course of antibiotics to prevent the infection. A follow-up is warranted as per WHO protocol within 7 to 14 days. Our FOXY guideline says that 15 days a follow-up can be advised to look for and check up if the process of abortion is complete or not. If there is a doubt, we can easily do a sonography at around 14 days, 15 days, and we can look for any signs of incomplete abortion. If there's bleeding, irregular spotting, if there is a complication, if there is excessive pain, then you are really advised to get a sonography done, which will help you to look at whether the products of conception have been expelled out or the procedure has failed, or if there is a need for doing a check curettage to clear up the remaining retained products of conception. The other method for abortion after the 9 weeks up to the 12 weeks is vacuum aspiration. It can be a mechanical one, electric one, that is by a machine by connecting with the system, or it can be a manual one. Whichever way it is, it doesn't really make a lot of difference in success, but yes, it is extremely useful to understand that that is a better method than the conventional DNC, which is being proposed by many of the older era protocols. So there is no doubt that a manual or an electric vacuum aspiration is a better option for doing the MTP. That's also sometimes called as a surgical method of doing MTP. The advantage of doing a surgical method is that it's a daycare thing. You get admitted in the hospital and within a few hours you can be sent back home. Ideally, you are advised to get admitted a few hours, 1 or 2 hours or maybe more before the abortion, and there can be some pre-medications given to help your cervix to ripen, and following which you get the procedure done and you can go back home within a few hours on the same day. Now, this method is a gold standard because it is being practiced for, I would say, not just decades but probably a century. But reality is this, that with the advent or with the availability of medical methods, the number of cases for surgical interventions have fallen down. For a simple reason, nobody likes to come and get admitted in the hospital. What about the third method, the second trimester abortions? In second trimester abortion, as of now, the law says that you need to have signature of 2 consultants. There is an amendment bill lying for changes, which is talking about possibility of a single doctor's permission, allowing that up to 20 weeks. Now, beyond 20 weeks, in special circumstances, for anomalous fetus, which can actually lead to a difficult outcome in the child, can be decided upon by the court on doing abortion a little later, even beyond 20 weeks, which is a tedious task. So we always say that the anomaly scan should be done as early as 19-20 weeks, so that we are sure about need for termination, if so, before the 20 weeks deadline, which is at present existent as of now in 2020. Well, with this I would like to summarize that every year almost 30 to 40 million people get abortions done, of which half of them are done in unsafe environment or unsafe methods. We don't want our women to suffer, and they should be having an opportunity to get safe abortions. So please, for God's sake, if so many women are getting the abortion done, it cannot be really so bad that you need to create some strict guidelines to avoid it. On the contrary, we should facilitate safe abortions instead of pushing them to unsafe area and landing up with complications and life-threatening situations. Stay safe, stay healthy.